as Dr. Navneet has pointed out, there is a lot of increase of asthma in pediatric populations also due to the change in lifestyle, food habits, and basically because of pollution. And pollution, the major contributor would be smoke, which is passive pollution. That is, for example, the parent in the family or the nearby, or if you go to any pub or in restaurant where we find a lot of smoke. This smoke also is a very highly allergic to kids, which most of the people are unaware of. So smoke can affect other children also. And secondly, the breastfeeding, which the government and pediatrics are aggressively promoting, is a very good protective mechanism for children from going to asthma, which unfortunately, because of change in lifestyles and the habits and the cultural thing, our people are not promoting breastfeeding. So this is one thing which can definitely play a major role in preventing or at least minimizing the asthma. And children are the most vulnerable because, as Dr. Reddy has pointed out, an adult may be knowing what is the trigger. Once he gets the cough attack or asthma attack, recurrently he knows this is the thing which is going to cause distress, so he will be avoiding it. But whereas a kid, he may not be knowing. And also there is one more entity called exercise into asthma, where a child, when playing in a school or when he is playing in dust, suddenly he becomes breathless, and sometimes they may drop down also because of the severe wheeze. So it's all the more important for the adults, as he told, it's a treatment should be among the entire family members also, because everyone should get involved. The school teachers, the parents, all of them should know what can cause asthma and how to prevent it and what is the immediate measure they have to take. Because there are many triggers, and unless until you know the triggers, it's very difficult to treat it. And once you know the triggers, it's very easy, and see that the child is isolated from that. And as rightly pointed out, breathing exercise and physical activity plays a major role in that. And as he rightly pointed out, indoor pollution. Most of us think there is no pollution in the house, but indoor pollution is the major cause of asthma nowadays. The indoor pollution could be from very trivial things which may not be knowing. For example, house dust mites. House dust mites ante chinna chinna krimulu untai corners lo. That can cause carpets or mana furniture మీద ఉండే ఇది upholstery if that is not washed properly. ఆ పాత రకమైన దిండ్లు మెత్తలు ఉంటాయి కదా, or pets like Pomeranian dogs which shed lot of dust, cats and dogs and cockroaches. So all these things, if we don't take care of, especially soft toys, చిన్న పిల్లల్లో ఈ బూరుబొమ్మలు ఉంటాయి, పిల్లలు they don't wash it and they keep on carrying it all the time. That is, or woolen blankets which are not washed properly, and if they cover it, that's thing. And AC filter if they are not changed. So it is the duty of the parents and also of the doctors to explain them, and also the media. Just common triggers can avoid, just 50 to 60% of asthma can be controlled. And as rightly pointed out, with inhalers, which is a miracle treatment. For the last 60 years, people were suffering from asthma, and only in the last few decades, this thing has come into a role. And unfortunately, there is a lot of myth among people. At asthma, there is a social stigma. And we as doctors request all of you to say and promote in the community, asthma is not to be worried about. It's not a stigma. It's not a social condition, where they can freely use inhalers. Inhalers are nothing but it's a sort of a spray through which a medicine comes, and that goes only to the lungs. It doesn't enter into the system also. So it's absolute. For example, debba tagilite ointment pettinate. So it doesn't enter into the bloodstream. It's pretty safe, no side effects, and immediate action. So the more people get aware about these inhalers, and it's better for the living, and especially when they're traveling or they're suddenly exposed to any attack, these things will help them a lot. But basically, as you said, all the stored products and coloring items, basically the color items, for example, we stop all soft drinks. The coloring agent that is used, that is highly allergic. By and large, the food has minor allergies, but the major is the environment pollution from different, different pollutants in the environment. That's what we need to take care of. Unfortunately, most of my parents, they keep protecting the child from eating everything, but they expose him to environmental pollution. Unfortunately, the child suffers and he is stopped from everything. So better you take care of the environment first. That's the most important thing which I would like to suggest to all the parents. And your question, today's meet is basically to create awareness among the general population that we are going to control asthma and make the child or the adult to have a near normal life. And the treatment is very simple. As he has rightly pointed out, it is only prevention and knowing the triggers and what to do when you get an attack. These are three things. And now we have also got prophylactic medications where on a long-term basis they can use, which are pretty harmless. And if they use them regularly, the chance of asthmatic attack are almost nullified. So this is what our aim is, to propagate the message that it is not something to be worried about, and it is the stigma of asthma should go away from the population. They have to treat everybody like a normal individual, and there are ways to protect and prevent these things. And also at the same time, the treatment is quite simple, plus a healthy living style, both for the adults and for children. Like an insect bite, for example, insect bites you get a rash, right? So there is a trigger which causes this, the finer tubes in the lungs to go, they get choked. So that's what it is.